So we're moving on to the Q&A now, and these are the questions that have been submitted either through the session or in advance. And the first one I think is a really common worry when first entering practice. So how to deal with imposter syndrome in your first days as a vet. And obviously I am not a veterinary surgeon, I am a lawyer. So I wondered if those of you who are vets in practice, who are recent graduates working in practice, whether you have any tips for students who are about to graduate about how to deal with imposter syndrome and feeling you know, perhaps not feeling the most confident when you start out. Have you got any advice to give to those that are about to embark on their first days and weeks of practice? I suppose a lot of it is having confidence in the fact that, you know, you've trained for this. This is what you've wanted to do, and kind of having faith in your own ability, speaking to your colleagues, speaking to senior colleagues, more experienced colleagues, and kind of checking that you're kind of doing what you need to be doing can help. Yeah, so all of those things. Emma, have we got anything coming in on Slido on that one?
No, I don't think we have.
Okay, and then we've got a follow-on here about how do you know if it's imposter syndrome or if you're actually not very good or struggling with the job itself. That's a difficult one, and that, again, that will be on case-by-case basis. I think probably if you are in if you're in practice, you'll have your you're going into practice kind of following graduation now, you'll have your vet GDP advisor, so they will be able to give you some guidance on how they think you're doing and all of that kind of stuff, and you can have those situations. But I think it's usual to feel doubts in those early days of practice, and actually to feel them throughout your career. I know we've got some more senior vets on the session tonight, and I'm sure they also feel doubt and uncertain at times, and it's not necessarily something that goes away, but it's something that you learn to trust your instinct and have faith in your own ability, I suppose. So there are lots of questions I see about discussing fees and discussing costs and all of that kind of stuff with clients, and how to keep their confidence if you're kind of suggesting tests and investigations. And I suppose what the person is getting at there is so that they understand why they're necessary, and that you're not just trying to make money or to or doing things unnecessarily. So, I mean, what we say is that you should always discuss fees openly and honestly with your clients. Make clear what it is you need to do things for. Give them a range of reasonable options, the prognoses, the likely charges, and really be open and honest at that outset. And if there are things that might be changeable, so for example, dentals are the absolute classic example, where you start off thinking it's just something small, maybe one tooth, and then you go in and have a look and there are other things going on in there. If it's something like that, what we say is you should be upfront with the owner that there might be changes going forward depending on what you find, and you should, if you do need to carry on significantly more work than you anticipated, then you should let the owner know and try to get consent for that if at all practicable. But obviously always keeping animal welfare at the heart of what you're doing. There are also lots of questions about what do you do where you don't know what's happening, or where you're not sure of the diagnosis, or where you want to ask a question but you don't want it to seem like you don't know what you're doing, which I think is absolutely valid. Going into practice, you want to project that kind of confidence, and you don't want people to be wondering whether you really know what you're doing because you're going to ask your colleague. But interestingly, and I hope this provides some reassurance on that, in that chapter 2 of veterinary care, in the supporting guidance, we do say that that part of providing good veterinary care is to consult suitably trained colleagues either within or outside of the practice when novel or unfamiliar procedures might be under consideration or undertaken. So that is something we recognise that happens, and we actively recommend that you seek help from colleagues when you're faced with situations and you're not sure what to do. And I think from just from general experience, I think most people will respect you for saying, getting as much information as you can and saying, I'm not sure about this, let me just go and speak to a colleague and see whether I can get any more information, or see whether we can progress this further. So I think most people would respect somebody just saying, I'm not sure, I need to go and ask a colleague. You can always just obviously get all the information you can, excuse yourself and go and speak to somebody. They don't necessarily need to know that you're doing that if you think that it might affect that relationship with the client. Again, it's one to deal with on a case-by-case basis, depending on what the owners are asking and what the situation is. What else have we got? As vets, are we obligated to see a patient out of hours even if they aren't registered with your practice? Well, that depends. So as we talked about earlier, if the animal is registered elsewhere, then you can redirect the client to their normal practice to seek out of hours help there. However, if for whatever reason they can't contact the vet, or the delay in getting to their normal vet would compromise animal health and welfare, you are still obliged to administer first aid and pain relief to get them comfortable so that they can obtain that help from their usual vet. And as we discussed earlier, where they are not registered with another veterinary practice, then yes, you should provide first aid and pain relief, but you don't have to do anything that goes beyond that. So I hope that answers that question. So how to discuss cost, especially when the owner does not have a lot of money but is not willing to put his pet to sleep and says that he or she will make it work. Again, that's one to be dealt with on a case-by-case basis, but you can look to explore other options. So you can look at those pragmatic care options. Is there anything you can do that is less expensive, that would keep the animal comfortable, or is euthanasia the only option? You could also look at redirecting the client to a charity, although obviously charities have eligibility criteria, and so they may not necessarily qualify, but it's something you can recommend. And actually we deal with that in chapter 9 of our supporting guidance. So do have a look at that. It's got a little bit more information on that.
Gemma, can I read out a question that we've had?
Yeah, please do.
Do you have
a voice different from mine would be welcome.
Do you have any advice for dealing with discrimination because of your age being a new grad?
I don't know whether they mean from clients or whether they mean from within the practice, but I think with clients, the only thing, they have their opinions, and to some extent there's not much you can do, but what you can do is reassure them that you're a veterinary surgeon, you are here to help their animal, this is your recommendation. They can get a second opinion if they would like, but this is what you are recommending. If necessary, you can go and speak to a more senior vet in the practice and get them to come and give a second opinion or something like that, just to kind of reassure the client. It's not easy, but it probably, I suspect it does happen, and I'm sure there are lots of people in this session that have come across issues like that. I think having confidence in your own conviction and communicating clearly that this is your professional assessment, and you are this is your area of expertise, is always a good approach. Let's see, what have we got?
I've also got another one, Gemma.
Yeah,
a slightly different area, but where do RVN stand when conducting nurse clinics with no vet in practice?
Oh, that's a question for a whole webinar on its own. But in essence, so an RVN is allowed to carry out medical treatment and minor surgery under the direction of a veterinary surgeon. And so it depends what the nurse clinic is. So if it's a post-op clinic, then they might be doing what they're doing under the direction of the veterinary surgeon. So they've had a discussion before, and the veterinary surgeon said, okay, this patient needs to do X, Y, Z. They can go ahead and do that, but it really depends on the circumstances. But RVNs must always be acting under the direction of a veterinary surgeon who has the animal under their care.
Thank you.
So let's have a look at whether there are any other questions coming in here. So how would you prepare for your first few days in practice? Did you ask your managers to see vaccines or boosters, for example? Again, has anyone, I am not a veterinary surgeon, so has anyone who is in practice got any tips for the students on the call about how you would prepare for your first days in practice? Obviously, from my point of view, I would say, please read the code of conduct so you've got an idea of the types of things that it covers. The key, while I'm talking about it, the key parts of the supporting guidance that you might find useful starting out are Chapter 2, which are veterinary care, Chapter 11, which is to do with communication and informed consent, so that's obviously essential, and Chapter 14 as well, which is to do with client confidentiality and the circumstances in which you can breach it. So those are the ones that you might want to have a look at before you get into practice. Obviously, there's a wealth of information on all sorts of things, but those are ones that you might find particularly useful for the beginning of your practice. Emma, I'm looking at the time, and I'm wondering if we should move on to the next question about learning points, if we can finish the Q&A there.
Yeah, I think we can. I've got all of the questions, so we can go through them and answer them in part 2 in January.
Yeah, so we can work through them and see if we can pick out the themes.
Yeah.
Absolutely. So back to Slido, have there been any key learning points from this evening? Anything that you didn't know before that you now do or would feel more confident doing going forward? So I'll just wait for it to get going. It seems that there were lots of questions about out of hours and obligations out of hours. So I hope that there's a little bit more clarity on that for you all. And if you do want to have a look in more detail about what veterinary surgeons' obligations are out of hours, then please do look at Chapter 3 of the supporting guidance, which has lots of information on what you should do in various situations. Yeah, so seek advice if you're unsure, absolutely. Ask for help, speak to more senior colleagues, speak to the RCVS, speak to somebody you feel comfortable speaking to. Yeah, my worries are common. I'm really glad that somebody felt that they feel reassured that they're not alone in feeling these kind of these worries in the early weeks of practice. Being open and honest, absolutely. Absolutely. You are the professional and it comes down to you at the end. And so you need to be open, honest and have integrity at all times, even when it's difficult, as in Hannah's situation it was, dealing with the farmer and the TB testing. Yeah, out of hours and first aid and what to do if there's a complaint. Okay, well, they're all really good learning points, and I'm so glad that you've taken those away, because that deals with a lot of the things that we wanted to achieve. So so thank you very much. If I just move on to the next one. So if you have any feedback, please please share it via this SurveyMonkey link. I think somebody is going to put it in the chat, so you can click on it straight away and give your feedback now. So thank you to Emma and Chloe for doing that. And just to sign off really by saying thank you very much for coming and for asking such intelligent and inquisitive questions about the situations we've had. A huge thank you again to the veterinary surgeons who did the videos for us. We're hugely grateful. I hope that the session is giving you some food for thought and tips to consider going forward. And yeah, we look forward to seeing you, hopefully lots of you and maybe some more on the 27th of January at 7:15 for part 2. And just to remind you that you don't need to re-register for that. Everyone who's registered to attend this one will automatically receive joining instructions for January. So thank you very much. And I think that's everything. I hope you all have good evenings and that the rain stops wherever you are. It sounds like it's still going here, but very nice to see you all.